can I ask you, Ayanwole, you talked at one point about stigma, and can you expand on that a little bit? Do you find that there are different levels of stigma among, for instance, different social demographics, different age groups, different locations in Nigeria? So between the city and the countryside, that sort of thing. Are there different levels of stigma? And if so, how does this stigma manifest?
Okay. First of all, let me quickly establish the term stigma. What does stigma mean? Stigma simply means a negative attitude of people towards something, condition, or anything. So stigma simply means quite well that when a particular person has a wrong attitude towards something, towards a condition, and they are showing their attitude to the person based on the condition or that particular thing in a bad light, that is stigma. So stigma could be a social discrimination. And so stigma could lead to self-isolation. Yeah. So now, to the question you asked, the level of stigma. The first level of stigma I want to emphasize over here is number one, the social stigma. Social stigma is more apparent, is more visual in Nigeria and in Africa particularly. Many quite well that people with disability, most particularly neurodevelopmental disorders such as autism, HAD, Down syndrome, they face social exclusion. People exclude them. They face social isolation. They are being isolated. They are being stigmatized. Yeah. People stereotype them. Yeah. Now, another level of stigma is the systemic stigma. That's number two. Systemic stigma or institution stigma. This stigma comes from parastatals, government parastatals, or a system, an organized system or institutions. The laws they create, their mode of employment, their modulus operandi is not in line, is not supporting individual with special needs. It's not supporting individual with neurodevelopmental condition. Look, for instance, maybe in terms of job creation, they rather stigmatize, they are not accommodating people with disability. Their laws, their rules and regulations, the criteria is not favorable to individuals with special needs. The last one I want to talk about is the self-stigma. And this is very, very dangerous. The self-stigma is the kind of stigma the person that has the disability or that has the condition that has himself. Because if people are advocating for you and you are not advocating for yourself, what's the essence? If you are stigmatizing yourself, if there is a word called like that, if you are stigmatizing yourself and people are not stigmatizing you, where can you go? Yeah. Your self-esteem, your self-concept will be downplayed. Self-esteem, self-concept is the way you view yourself. Self-esteem is the way you carry yourself. So if you have a self-stigma, you isolate yourself, you feel you have a negative attitude, negative thought about yourself based on your condition, you're now trying to behave in a particular way that is not supportive, it's not going to help matters. In summary, the categories of the stigma we have, like I said, we have the social stigma, which comes from the environment, the society. We have the systemic or institutional stigma, which comes from parastatals, institutions that we have in our society. And I also mentioned self-stigma. And some of these stigma, we should avoid them. If we are going to grow, if awareness is going to count, if therapeutic approach, if government and other people are going to come in aid to support people with neurodevelopmental disorder, they have to abscond, they have to leave, they have to avoid this level of stigma. The society needs to avoid it, the government needs to avoid it. And just in one line, what are the effects of this stigma? Stigma can lead to self-discrimination. Stigma can lead to low self-esteem. It can lead to emotional distress. Whether the person is full of a lot of emotional dysregulation, he can't control his emotions, he's just done, totally done. It makes the person to be unproductive. So, in summary, stigmatization is a big problem that is affecting neurodevelopmental disorder and that is affecting individuals with neurodevelopmental disorder. We have to avoid it as an advocate. We have to avoid it as a society, and we have to make a room forward for them to thrive in everything they do. Let's accommodate them. Let's include them. Let's practice empathy, not sympathy.